com hit.
So Chris, I have Isabel on my screen up here, and then I have David on the big screens. Okay, perfect. Thank you so much. All right, so Isabel Erickson, she comes to us from Boston, and she is revolutionizing technology at the intersection of innovation and humanity with a focus on human-centered design. She has over 5 years of expertise in AI systems, physiological signals, and biomechanics. She's also led projects managing over $5 million in DoD and commercial research funding. Her groundbreaking contributions include wearable systems for heat stress monitoring, non-contact vitals monitoring for senior living, and AI agent systems for research. She's performed design control for FDA-regulated systems at Medtronic and GE Healthcare. And she holds an advanced degree in industrial and biomedical engineering from the University of Wisconsin-Madison. And with that, she's shaping the future of connected care and empowering aging populations. I would like to introduce to the stage Isabel Erickson.
Yeah, thanks, Kendra. It's an honor to be here and really excited to share my work with everyone. I think we got getting the slides up. All right. Here we go. Okay, so I come from Aptima, which is a small business. We've been around for about 25 years, doing research with the DoD in the healthcare space. We actually have an office here in Orlando that come to you from our headquarters in Boston. So for my talk today, I'll be doing it in 3 parts. First, touching on the rural aging challenge, then talking through some recent innovations in remote patient monitoring, and then finally talking to you about our case study that we're actually about to start on Thursday. So first with focusing on the problem. So senior living costs have been steadily increasing to reaching near $64,000 plus a year, and aren't a lot of programs that support. So Medicaid eligibility is limited, especially for middle income seniors, and Medicare does not provide coverage. So a lot of seniors are finding themselves without having the coverage to be able to be in a senior living facility. And in rural communities, this is even worse because oftentimes there's not even options for them to be cared for in their area. And I need to preach to the choir here, but there's a lot of staff shortages and small margins in a lot of these rural senior living communities. And this causes even more problems for the caregivers that are trying to support their loved ones. They're isolated, unsupported, and don't have, oftentimes have respite services. So remote patient monitoring seems like an obvious solution. So some of the main areas that they need support in, and obviously in the clinical, a lot of these seniors have problems with chronic disease and medication management, and they really need an early detection so that you can assess if something is happening and nip it in the bud before they have to go to severe care. Also with technology acceptance, we need to make sure that it's integrated with primary care or a way for them to get an intervention for any issues that they're seeing. Also has to be quick and easy to use because the caregivers and the seniors themselves can't really manage all this new technology. And then finally, with the social supports, we need to involve the family and the caregiver because oftentimes the senior isn't able to take care of this on their own, and provide companionship and engagement so that like we heard from the Can We app, loneliness is a big problem. So some of the limitations that traditional RPM has is that it needs to have patient adherence or caregiver support to actually take those vitals. Like you can see in the picture, have to do the blood pressure cuff, you have to remember to charge it, you have to remember to put in the number that comes out. So that requires technology acceptance and digital literacy. And then There's also need to have trained staff to review the vitals, and it can be confusing for the caregivers, like what do these numbers actually mean? Is my loved one okay? And it also doesn't capture other important things about their health, like cognitive decline, how are they doing emotionally, and how are they doing with activities of daily living. So next, I'll be talking about some promising technologies and solutions that can hopefully bridge this gap. So 3 areas I'm going to focus on is AI-powered decision support. So AI has been huge in the last 5 years or so, and I'll try to break that down for you guys. Then new sensing technologies that allow us to not have to take the vitals, but get them passively. And then focus on mental and behavioral health support. So for AI-powered decision support, I'm sure all of you guys have heard about ChatGPT, and this type of model is what is called a foundation model, and so that is trained on basically all of the internet, and that is helpful in certain situations, but it also is, you can't really, once it's trained, that's all the information that it has. You can't really update it, and so that's causing this new shift to what we call compound or agentic AI. And what this is that you can use many different foundational models. So ones maybe they're focused on text or focused on images, and then also use what's called retrieval augmented generation, which then is able to extract information that's new. Maybe you have like new information about a patient or new research that's come out. And these types of compound and agentic systems are able to take all of that data together to really make sense of it and quickly adapt to new patients, new situations, and provide that holistic assessment and not have to require to do constant retraining. So this can really empower our RPM systems. And so some additional use cases for this is a clinical documentation assistant. So it can listen to, as the caregiver is talking to the patient or the clinicians, and it can note down all of that. And for example, maybe it could summarize that and provide it to the family so that if they don't remember everything that happened, it could help them to understand. And it could also reduce the burden on the clinicians and their note-taking. And then for precision medicine, this is a great way to provide that early warning, like I mentioned, that proactive care, because we're able to assess like how the person is doing according to how their vitals are. And so, for example, if somebody had naturally a low heart rate, when their heart rate is elevated, it may not be as high as if someone has a higher baseline. So that way we don't miss warnings, for example. And then it can also do better personalized treatment plans and really assess how we're doing on that person's vitals. So next, talk about contactless sensing. So there's some new technology out that prevents you from having to wear things like Apple Watch or Oura Ring. So there's ballistocardiography, and that is, as you can see on the right, there's the mattress sensor. And so it goes under the mattress but above the bed spring, and it's actually able to measure your heart's forces as it's beating and detect that heart rate. And it can also detect respiration rate and blood pressure through these sensing. And there's also radar-based sensors that can go onto the wall, and it can detect the same things as you're just laying in bed and resting. So these new technologies prevent the need for the caregivers and the patients themselves to have to remember, I need to put on my sensor, I need to charge my sensor, I need to make sure it's connected, all of that. It's a set and forget is the new future of RPM. And then for mental and behavioral support, so for here, you need to remember for remote patient monitoring that it's not just about the vitals themselves. We also need to consider the whole health of the patient and not just like what their vitals are. And so it's important to consider things like how much time are they spending in bed? Is this changing? How are they, as their activities are they continuing to engage socially? And some new ideas around this is to utilize conversational AI to kind of chat with the patient, and it can better understand like how well they're doing. For example, even in like their tone of voice and how like excited they feel. You can really sense a lot of that in the AI, using AI. And then finally, I found this when I was doing my research for this presentation, this LEQ robot I thought was really interesting. So it's like a bedside, tableside companion, and it can interact with the senior. And it not only is like an Alexa where it just, when you try to talk to it, it talks to you, but it actually reaches out to you and tries to help you to remember to things like taking your medication or to think about memories that you have, and can even help you to better interact with your family. And so I think this is a lot of the future of where we're going. So then finally, I'd like to talk to you about our new RPM that we're trying to use a lot of these new technologies and implement them. So what we're calling our new product is Sidekick RPM, and we're working with a senior living facility in Pflugerville, Texas. And we're currently at this first stage where we have these contactless sensors deployed, and we have developed some algorithms and a front end. And we're going to see how that works being on site. And then we're hoping to move to stage 2, where we focus on that resident and family engagement, where we have an application that the families can use at home that can give them information about how their family member is doing, and in a really easy, explainable way. And then third, we're hoping to use this at home. So a lot of times the senior living facilities, they aren't able to put everyone that's interested into a bed because there's limited beds. And so this could be a way for them to engage with those potential residents and provide them some care before they're even in the facility. And then finally, our grand goal is to offer this as a paid service, for example, for people that maybe can't afford to be in the senior living facility, or if there's not enough space, and give them this care through the senior living, even though they're not actually living there. So the way that we think about the system is 3 stages: the sense, assess, and augment. And start with the sense. So like I said, the key characteristics is that we're focusing on, for beginning, health vitals and sleep behavioral habits. We're hoping to add more of the cognitive and emotional health as well. We're using those bed-based sensors to get some of these measures. And then assess. So the way that we developed our analytics, we wanted to keep it as simple as possible so that it's easy for the caregivers and the nursing staff to understand. And so we use this idea of an acute baseline that uses a consistent baseline over time and kind of assesses how that is changing over time and adaptively updates based on how different it is from the last 24 hours. And then we use that to calculate a daily health risk, which is a holistic measure of how irregular the vitals are. And this kind of puts together all of the different ones like respiration rate, heart rate, things like that. And then finally, we look at how the baseline is changing over time, and that can help us understand chronically how the patient is changing. And then finally, I'll have this slide and then a couple more slides that show what our front end, or what does it look like when the staff is looking at these vitals. And so we designed it based on different roles. So there's the nursing staff that will look at more in-depth data, and then there's the caregiver level that may just want to look at overall health risk and know, like, what do I need to do? And then there's like the night staff view where they're just more interested in is anyone in immediate need? And so I also have a live demonstration of this that's over there, so feel free to come and check it out. So like I said before, we have the night incidents, so that's kind of the top view where you can see which residents are out of bed, how long have they been out of bed, which sensors are out of service, so that you can prioritize those night checks and make sure that no one is going to have a fall because they're getting up all of a sudden in the middle of the night. And then for the morning report, this can help to the nurses to do their morning checks. So you can see maybe we have some of the patients that are lower, you'd want to check on them first. Maybe they had a big increase in their heart rate, so we want to check to see if they have a fever. Maybe we can isolate them so that they don't infect any of the other residents, for example. And then here's just some more pictures of it. So you can see the health score and you can see the different metrics there. So kind of showing that the respiration rate is out of range for what it usually is. So it may be something to check in on. And then you can also dive in to see more in depth if you are, for example, like a registered nurse, and then have that personalized vital assessment. So we're not just using like if you have a heart rate over 100, then we're going to alert. It's all dependent on the person themselves. And so finally, I think senior living focused RPM is going to be the future. And for seniors, it offers a proactive care that can prevent crises, also provides care at a lower cost and decreases burden on the active device use by using the contactless sensors, which is really essential, especially for memory care. For caregivers, it provides a peace of mind and decreases their burden, which allows them to have a stronger connection with their loved one and improves coordination with the care team. And then finally, for the senior living facility, this can even be a new revenue stream for them, and it can help them to connect and build trust with potential future residents, and also allows them to potentially employ more staff. So that concludes my talk, and just want to give a big shout out to the team, Sylvan and Peter, for all of their work, and I'd love to talk to you at the booth. Yeah, thank you, and open for any questions.
All right, so is this something that you see that could work in your communities?
So I spoke with your, oh geez, that's loud. So I'm monitoring my mom at home. So we talked about briefly how you could give the information to family members that are out of state that can help monitor your loved one at home. Is there a limit on how many people you can expand that access to?
So there isn't any limit.
Okay, awesome.
So the technology, is it an audible alert when it's out of the parameter, or is it just a notification in the system?
So you're saying if it's a concern, is it like an alert?
Correct.
Yeah, so currently our system doesn't have alerts, but we could definitely change that. And so right now we're about to do a deployment where we're going to work with the staff and see what do they actually want alerts for, because sometimes there's a lot of alerts that are overwhelming, and so we want to try to figure out that medium. So we're starting at no alerts and then planning on moving up, but I think it also changes, let's say, when we use it in the senior living facility, it might be different than if we use it with caregivers at home. For example, you might want to change how the alerting works.
Correct. So my additional question on top of that, for like say someone who's living at home who doesn't have a nurse there, would it involve integration of like the 911 system? So let's say your mom is living in Kansas and you're in New York. Obviously you might be asleep and it might not respond and let you know, but let's say someone's heart rate dropped below 40 and their normal is like 80, would it activate the 911 system, or is that a thought for the future maybe?
Yeah, so we haven't gotten to focus as much on the at-home system, but that's a great point. And I think the idea behind what we're doing is that we want to connect to those physicians that are with the senior living facility, and so they would have a good sense of like emergencies and when to call, and they have someone on call, so that's kind of how we're thinking about incorporating that.
Okay, thank you. I appreciate you.
Any other questions for Isabel? This is really exciting technology that she's presenting here, and I think there are a lot of practical applications for MIH programs. No more questions? So I do have kind of just a curiosity question, and I understand that the alerts that you're talking about, it's either in the bed or it's over the top of the bed, but like the Gene Hackman situation, for instance, where nobody knew that he had passed away and his wife had passed away, is there something that you guys do that could have helped with that particular situation?
Yeah, I think definitely. So I think, well, the system we have right now is more focused on longitudinal assessment, but we would be able to detect like right away if there was a drop to, especially like to 0, and we could provide some alerts there for sure. Yeah, so I think in the future we need to think more about the home integration part. We haven't delved deep into the nitty-gritty on that yet.
Oh, we do have another question over here. Judy, go ahead and use this because we have people on the line today.
I'm curious about research that may have been done on the effectiveness in this. I was involved, about 20 years ago in some remote patient monitoring where people with congestive heart failure would weigh themselves every day. It was a smart scale. It would send the message out to, and a nurse would call them if their weight went up, meaning they were retaining more water. I wasn't there long enough to do any effectiveness studies, but it was our hope it was going to keep them out of the hospital.
Yeah, so I think I need to go do more research on that, but what we're hoping to do with this study now is to get some of those ROI metrics I know that were talked about before, so that we can get more funding for this and grow it, make sure that we're focusing on the right areas.
Yeah, because if you can show that it actually reduces hospitalizations and really improves those outcomes, that would be awesome.
Yeah, definitely. I think that's one of the reasons why we're starting in the facility, because there's more of that data available for us to use.
Thank you so much,
thank
Isabel.
you.
All right, another round of applause for Isabel Erickson, and her booth is over in the far corner, over by the ComHit Step Up and Repeat. So at the next break, definitely go and say hi to Isabel.
ComHit.